Hello and welcome to the Grace Hospital EDIS clinical documentation video for consulting MDs. This video is intended for consulting MDs who have used the clinical documentation at other hospitals. On July 7th, the Emergency Department Information System, otherwise known as EDIS, at Grace Hospital Emergency Department is expanding to include electronic clinical documents. The EDIS ClinDoc set being introduced is similar to the set already in use at St. Boniface, Seven Oaks, and Victoria emergency rooms. St. Boniface is also using a similar set of clinical documents in their inpatient areas. This table displays the notes being introduced as well as the key differences between Grace Hospital and other hospitals. The notes being introduced at Grace Hospital are the Assessment Note Emergency Prescriber, Assessment Note Emergency Nursing, Progress Notes, there's two types, comprehensive and general. There's Vital Signs and Care and Assessment Flow Sheets, Procedure Note, Discharge Summary Note, as well as a Consult Request and Consult Note. These same documents are in use at Victoria General Hospital. Seven Oaks ER is using mostly identical set with the exception of the Consult Request Note, which is being planned later. St. Boniface ER is using the identical set, although they use physician order entry for their consult requests. St. Boniface Inpatient use documents similar in nature, with the history and physical document similar to the Assessment Note Emergency Prescriber, the initial assessment similar in nature to the Assessment Note Emergency Nursing, and the Discharge Summary similar to the Discharge Summary Note Emergency. Grace Hospital will also be introducing a auto-faxing to the primary care provider of an ER visit summary report. The ER visit summary report pulls information from the documents in EDIS into a report sent to a primary care provider or other patient providers. Grace Emergency is also introducing additional workstations and integrating the use of clinical documents into their downtime procedures. How are you impacted? For consulting MDs, they'll be able to view the patient chart, documents, flow sheet, and clinical summaries tab, view the consult request note, respond to the consult using the consult note, additional documentation using progress notes or procedures documented using procedure notes, as well as a summary to the primary care provider can be included in the healthcare team notes section of the Discharge Summary Emergency. Go Live activities. On Monday, July 6th, there will be an open training lab for users to practice located in the Finance Conference Room. During the Go Live, starting July 7th, there will be a command center on site supported by Manitoba eHealth to assist with troubleshooting 24 hours up to 7 days. Rovers and super users will assist users in the ED department, and service desk is available to record any incidents. I will now show briefly the EDIS clinical documentation set planned for use at Grace Hospital. In viewing the patient's chart, the documents can be viewed under the Documents tab. To view a document, select and then double-click. Once the document is reviewed, the viewing window can be closed by using the red X. Flow sheets being introduced at Grace Hospital include the Vital Signs flow sheet and the Care and Assessment flow sheet. These flow sheets are identical to those in use at the other hospitals. Details about the chart can also be viewed using the Clinical Summary tab. There are 3 views: Physician, Nursing, and Allied, which are identical to those in use at the other hospitals. From this window, there are vital signs graphs for blood pressure, heart rate, temperature, and weight. However, the blood glucose insulin and INR warfarin will not be graphed as they require the use of physician order entry. The Patient Info tab can also be used to view visit history for the patient. If the patient has a visit in another hospital using clinical documentation, documents can be viewed by first going to Visit History, double-clicking on the visit which you wish to view, and then selecting the View Documents button. Upon review of the chart, the Consult Request note can be viewed on the Documents tab. The Consult Request note will show the consulting service that's being requested, who has requested the consult, the type of consult, indications and relevant clinical history for the patient. Notification of consult will be done the same as it is today. So if you get paged, the details regarding the notification, the date and time, and the provider who is notified is also listed in the consult request note. To complete the consult note, going back to the EDIS status board, notes can be completed by selecting from the Quick Launch Documents arrow, so the arrow right beside the button. This will display all the possible notes that can be opened. In this case, we'll open the consult note. From within the consult note, the first drop-down list is the service or discipline responding to the consult. This must be filled out in order for the documents to sort properly on the Documents tab. The consultant may also type in who has requested the consult based on the information found in the consult request. There are many sections of the consult note which are identical to those used. This note is identical to that used at other hospitals. Each section is optional, does not have to be completed for every patient. It's based on patient need and user preference. I'll now briefly go through the sections of the consult note. First section is History Present Illness. The second section is Medical History. Chronic problems are not in use at Grace Hospital, but surgical procedures can also be entered. If the patient has had medical history recorded at another site or at Grace Hospital, they will be listed here and can be included in the note by selecting the checkbox next to the problem. Family medical history and social history, allergies, review of systems, vital signs, physical exam, body images, lab results, diagnostic results. The next section is consultant findings, which is a large text box which could be typed. Or if you use acronym expansion, your same acronym expansion library that you use at other sites can be used. The impression plan section will not be used by Grace Hospital. The recommendation sections is an additional text field, which is optional. And we recommend that all consultants add themselves as a care provider upon completing their note. To add yourself as a care provider, go to the Add Care Provider section and select the Add Item button. Then click the Add Me and choose, in this case, the role Consulting. Once you have completed your note, press Save, and if it's completed, you can submit as final. I will now briefly overview the other notes which may be used by consulting MDs. For progress notes, there is a Progress Note General. This is identical to the Progress Note in use at the other hospitals and consists mainly of the Related To drop-down and a text field. The Progress Note Comprehensive, which starts similar to the Progress Note General with the Note Related To drop-down and a Progress Note field, but includes various other sections. The Progress Note Comprehensive is identical to the note used at other hospitals. The Procedure Note. The Procedure drop-down lists all of the available procedures, including Other. Once a procedure is selected, the note will customize to that procedure and will always include an additional details text box. Consulting MD may also wish to enter healthcare team notes on the Discharge Summary Note Emergency. The Discharge Summary Note Emergency is largely completed by the ER physician, so consulting MDs can enter notes under Healthcare Team by first selecting their discipline or specialty and the date, and then complete a summary in the text field. This summary would be included in the ER visit summary sent to the primary care and other patient providers. This concludes the Consulting MD training video. If you have further questions about EDIS ClinDoc at Grace Hospital, feel free to contact the contact information listed. Thank you.